Good morning, everyone. Good morning to our education supervisor in special education, Sir Randy. All the principals around and all the SPED teacher of Davao de Oro. Good morning. Today, the group teachers teaching the visually impaired learners will present to our output in crafting our teacher-made psychoeducational assessment, particularly for the visually impaired learners, which comprise of the regular low vision, the regular blind, the multiple disability low vision or MDLV, and the multiple disability totally blind or MDTV, that we come up with the checklist that range from this disability. So here our
teacher-made psychoeducational assessment tool for learners. We start with the cognitive domains ages 3 to 6 years old. And the other side, the can do and can't do of the learners. Number 1. Look at the direction of the following objects. 2. Matches objects. 3. Names 4 to 6 colors. 4. Arrange things from smallest to biggest. 5. State what is wrong in the picture. 6. State what common household item used for. 7. Assemble simple puzzles. 8. Read sentence without losing its place and skipping lines. 9. Copy simple words without missing letters and lines. And 10. Matches upper and lower case letters.
cognitive domain checklist challenged pupils was difficulty in seeing how near or far their visual field and visual acuity in differentiating the primary from the secondary colors. When exposed when buried of shadows, VI teachers can observe to detect the measurement of font size of words in reading. And by that observation, teachers can decide either how high the number to enlarge the text so that pupils, particularly low vision, can conveniently read words without the scenario of tipping like a pipeline in reading.
For motor domains, let's start first with the fine motor. Number 1. Uses all 5 fingers to get food, toys placed on the flat surface. 2. Pick up objects with thumb and index finger. 3. Displays a definite hand preference. 4. Put a small object in and out of the container. 5. Unscrews the lid of the container and unwraps food. So, for the gross motor domain, that's number 6, climbs on chair or other elevated piece of furniture like a bed without assistance. 7. Walks downstairs with one hand held. 8. Walks upstairs holding onto handrail. 9. Moves body part as directed. 10. Jumps.
In motor domain, individualized situation ranges from low vision to totally blind. In learning environment, motor activities in the classroom focus more on what is inside the box, particularly the blind, where the vision is restricted. Through this applicable checklist, it can be observed how far their motor skills in learning develop and some points to consider in their orientation and mobility.
For socio-emotional domains, number 1, enjoy watching, listening activities of nearby people or animals. 2, plays alone but like to be near familiar adults or brothers and sisters. 3, laughs or squeals aloud in play. 4, stop and think before acting. 5, imitate friends' behavior. 6, plays peekaboo, bulaga. 7. Shares toy and wait for his/her turn. 8. Use words to describe feelings. 9. Understand rules. 10. interprets emotion from facial expression and intonation.
In socio-emotional activity, visually impaired learners confidently mingle with other peers when they frequently meet them. Teachers need first to win their trust from their comfort zone before administering of what is in the checklist.
For language domain, number 1. Names family members and other familiar things heard if asked. 2. Says 5 familiar things recognized in a specific area. 3. Follows simple instruction with the use of preposition like under, over, beside, and others. 4. Picks up things as with direction. 5. Put on slippers, shoes as directed. 6. Use 5 to 10 words. 7. Names things seen. 8. Ask what question. 9. Ask who and why question. 10. Reason out simple situation.
Totally blind pupils expressive voice out there in communication. Teacher tests them if they follow instruction and see to it that the barrier in communication settled and confidently reason out simple situations that arises.
For self-help domains, we start with self-feeding. 1. Feed self with finger food, example, biscuits, bread, using fingers. 2. Feed self using spoon. 3. Help hold cup for drinking. For independent dressing. 4. Participate when being dressed, example, raises arms or lifts leg. 5. Pulls down collared short pants. 6. Dresses without assistance except buttons and ties. For hygiene and toileting. Number 7. Inform adults and need to urinate or move bowels so he or she can be brought to a designated place, example, comfort room. 8. Wipes clean self after bowel movement or poop. 9. Participate when bathing, example, rubbing arms with soap. 10. Washes, dries hand.
Self-feeding, independent dressing, hygiene, and toileting are most important milestones of the child to be trained at his/her early age. For children with visual impairment, needed to be task analyzed for them to be trained particularly and totally blind. So here now the summary of our educational assessment tool for the visually impaired that comprise of the 5 domains. And how do we check their scores? Example here in quarter 1, he has 8 scores in cognitive, 8 in motor, 6 in socio-emotional, 7 language, and 6 self-help with a total of 35 points. So we scaled that in the standard score of 70% and we interpreted that as prospect slight in overall development. So here now the interpretation of standard score or development index. The percentage score in 69% and below, the interpretation is prospect the delay in overall development. For 70 to 79%, prospected slight in overall development. For 80 to 89%, for average overall development. For 90 to 100%, it is already an advanced development. So that is how we interpret. And that's all our output for teacher-made psycho-educational assessment tool for learners with the collaboration of all writers for teachers teaching visual impairment headed by Ma'am Lorelai E. Quijano of Compostela Central Elementary School, Ma'am Margarita B. Di Pornilac Central Elementary School SPED Center, LVV Himinyo of Mawab Central Elementary School,
Marciana A. Martinez of Maragusan Central Elementary School SPED Center, Alana Charis Y. Espina of Kingking Central Elementary School SPED Center, and Erlinda E. Gunyado of Nabunturan National Comprehensive High School. And that's the end of our report. This is Margarita Vertudaso Di Parini, presenter.